The New York State Nursing Association has won a temporary victory in its effort to keep the Long Island College Hospital open in Brooklyn. A judge has issued this temporary restraining order to stop SUNY from closing the facility while the case is under review. SUNY officials say LICH is losing $4 million a month, and selling the hospital is the only way to protect the Downstate Medical Center, which also operates this facility. But hospital employees say closing it would be bad for patients and the neighborhoods it serves. Here to explain more is the Executive Director of the New York State Nursing Association, Jill Furillo, and also the group's first Vice President, Judy Sheridan-Gonzalez. Thank you very much for being here. Thanks both of you. I appreciate it. So let us set the stage here because I think that viewers up in our neck of the woods don't know. This hospital, where is it and what kind of population does it serve?
Well, the hospital is in Brooklyn, New York, and it's serving a wide range of communities in Brooklyn. It's situated in Brooklyn Heights, which is near Manhattan, but it also services a population that is in Gowanus, as well as Red Hook, and communities that are medically underserved communities, large populations that need the hospital and are serviced by that hospital, and they get very, very good care in that hospital.
And where's the next closest hospital?
The next closest hospital is Brooklyn Hospital. Also, Interfaith Hospital is nearby. Interfaith Hospital is another hospital that is also threatened with closure. And you know, New York State Nurses Association has been leading the fight in Brooklyn to keep our hospitals open for care. And we are going to continue that fight because we can't let these hospitals close. The entire borough of Brooklyn is affected by these closures.
And how many people are we talking about in terms of employees, in terms of staff who work at the hospital, who would be laid off? 2,000, is that around?
I think it's about 2,000, maybe 400 registered nurses.
So, but the idea here that's concerning, I think, to you writ large is that there's a movement away from this kind of model, which the state says is losing money, and to a for-profit model, which is not something that exists yet in New York.
Right, we have grave concerns about the for-profit model because if you think about it, when somebody should not be making money off of somebody's illness or somebody's health care, and when you have a for-profit model, there's a certain amount of money that gets skimmed off the top that doesn't go for care, that doesn't go for research, and that doesn't go to provide the services that people need. And those models, as Jill can tell you, really haven't worked in the areas in which they've existed.
I can give you an example. You know, recently with Hurricane Sandy in New York City, we were able to see the Bellevue nurses. The Bellevue nurses work in the HHC system, which is a public hospital. And in that scenario, the nurses were able to safely evacuate over 750 patients to safety. No one died in that scenario. Whereas in New Orleans, which were all for-profit hospitals, the Tenet Corporation had 10 hospitals in New Orleans during Hurricane Katrina. In that scenario, many, many people died as a result of the lack of care being given and lack of attention by the corporation to the actual situation.
So what we're when the state says, and this is a question for whoever chooses to answer it, we're losing, you know, $4 million a month. I mean, what is that a result of? Because it sounds, you say, but the care that the patients are receiving is of the highest quality. That the nurses, obviously, and the medical staff are working very hard. But where's the shortfall, and how to fix that?
There's been incredible mismanagement over the years of Long Island College Hospital. It was a hospital that has a 150-year history of innovative care. It was managed very well in the past. When Continuum took over Long Island College Hospital several years back, basically we're actually calling for an investigation as to what happened there. Because you hear reports of physicians billing for millions of dollars and maybe thousands are trickling in. There's some nefarious goings on that took place before, and when the state took over the hospital 2 years ago, there was no resources put into the hospital, no support for the hospital. In fact, we believe it was a thinly veiled attempt to be able to sell it for prime real estate and just completely rob the community of a healthcare facility.
Well, right. I'm actually familiar. I've lived in Brooklyn Heights briefly, and so I'm familiar with this facility, and it is in an area that's growing enormously, right? And it is in an area where real estate is of prime value. Is the concern also that this gives the for-profit hospitals a toehold? Because if it works, or works in the state's eyes at any rate, then they subsequently say, well, look, let's move on and do this all over the place.
We think that there is an attempt by the part of these these interests that Judy spoke about to try to introduce this for-profit model into Brooklyn, and trying to utilize some of this mismanagement, some of the issues that have come up around Long Island College Hospital. Although I want to say here that Long Island College Hospital, despite this mismanagement, the doctors and the nurses and the caregivers have given excellent care, and the community continues to come to that hospital, and that hospital is rated among the top 25 hospitals in the country. So it's been despite the mismanagement that the hospital still has an incredible reputation serving communities of need, and if this hospital were to close, this would be a domino effect in that borough. We would see the other hospitals impacted by the patients who would then have to go to these other hospitals that already don't have any space available and already don't have any beds available.
So what's the timeline here? I mean, you did win a short-term victory with the courts, right? But my understanding is that's temporary while this case plays out.
Right.
Is that right? So then what happens next?
Well, we think the governor needs to step in and, you know, do the right thing for the people of Brooklyn. You know, you have this scenario where they destabilize an institution financially through means that are very, very suspicious, and then you rob a community of a healthcare facility, and then you say that these for-profits are going to kind of swoop in and be their saviors, when in fact it looks like this has been happening all along. It's kind of a conspiracy. So we think the governor needs to step in and really take a look at what SUNY's doing and come up with a plan that allows the hospital to be purchased by another facility or another corporation.
Yeah, and we just want to add to that. We have nurses coming up here tomorrow.
You do?
On a bus from Long Island College Hospital, from Interfaith, from other hospitals in Brooklyn, and even other hospitals in Manhattan, to deliver petitions and cards and letters at the Department of Health, because the Department of Health is probably getting ready to have some kind of a hearing that would look at what Long Island College Hospital has submitted to them. But the judge has instructed the Department of Health and Long Island College Hospital to make no efforts whatsoever to close that hospital, because the judge said thousands of people are impacted by this decision, and thousands of people are impacted by a potential closure.
But the judge's decision was based on the manner in which the SUNY board voted, is that right? It seemed to be sort of a technicality. In other words, he issued the injunction largely not because he was ruling on the whole case in its entirety at this moment.
Yes, he absolutely is looking at the issue that was brought before the court, which is the issue of the SUNY Board of Trustees basically ignoring the Open Meetings Act, the Public Open Meetings Act. They violated it, and the judge seems to believe that there's some potential credibility to that. So the judge felt that see, what SUNY was trying to do in the court was to say, well, okay, well, if you're going to rule whether or not this meeting should be held over again, then you should lift the temporary restraining order. And the judge said, I'm not going to lift the temporary restraining order because I believe that the impact to the community is very, very crucial.
It's an interesting thing because it happens to be Sunshine Week. Just throwing it out
there.
Oh, yeah,
which
there focuses
Sunshine Week,
public
open
meetings. There you go. Just in closing, and this question again to either of you, I mean, what do you think, if there's a takeaway, because this is an intensely local issue for Brooklyn, obviously, but and potentially for other hospitals in New York City, but for the upstate community, is there a takeaway?
This is the tip of the iceberg. I mean, we see something similar happening in the Bronx, whether it's closing a facility that's working or closing a facility and crowding everyone in a community. Where I work in the Bronx, if they close, they're restructuring Westchester Square Hospital. All the other emergency rooms and all the other hospitals are totally crowded. We have patients in my hospital waiting 3 days for a bed upstairs on ventilators. I mean, the situation is critical. It's going, I think some things have occurred already upstate where there's been this reconfiguration, and if this is allowed to happen, it's going to be hitting every area. We're just the kind of experiment. They said one other hospital aside from Brooklyn is going to be subjected to this for-profit. We don't know where that is. It could be where anybody watching this program could be living. And we are trying to fight back here and fight back hard.
Well, the nurses will be here tomorrow.
My takeaway, what I would add to what Judy is saying is that the New York State Nurses Association is leading this struggle and leading this fight to keep our hospitals open so that people can have access to care. There's no community that should be shut out of having equal access to care, and we're leading that fight, and we are not going to stop. We're committed to this fight. We are patient advocates. We are there for our patients, and we are not going to stop. And we are uniting with the community. We're uniting with religious forces. We're uniting with other unions to keep our hospitals open for care and make sure that they're not being run for profit.
Well, the nurses, as you said, will be here tomorrow, correct?
Yes.
Very good. So we'll follow this. I thank you very much, both you, Jill and Judy. Thank you for being here. I appreciate it.
Thank you.